Hey y'all, what's going on? This is J. Marie at J. Marie Booklist, and today I'm making a video about where do you keep the medical record. So when a patient is discharged and you break down the chart, so this is the patient's chart. You take all the paperwork out because they're discharged. You take off the label, you take off everything on the side, and you open it up and you take the paperwork out. You get a rubber band, you put it somewhere. 9 times out of 10, the paperwork is somewhere near charts. Okay, it's somewhere near a chart. So when you think of your floor, think of where you put the medical record, the paperwork, so that medical records can come and get it. Think about where it's at. 9 times out of 10 is by charts. Okay, it's by either charts that you're still using, or it's by charts that are empty. You have extras and you have them somewhere. And give you a perfect example. So like I always knew to look for charts whenever I would float to another floor, because that's where the medical records would be kept. So in the ICU, when a patient was discharged and we broke down the chart and we kept it, we put it in a cabinet. And the cabinet was directly over the charts. Okay. And these were the ones that we used. So the doctors would come get the chart and everything. But when they would be discharged, we would put it in the cabinet. So medical records knew to go there. And then when I worked on the main floor, they were kept in the dictation room. And so the doctors would go in there, and originally I think that's where the charts were kept, and then they did construction and put the charts out at the nursing station. But then they did construction again, and the charts ended up going back in the dictation room, because that's where they should have been anyway, because it was like real, because they were there and then they put them out at the nursing station, and you was always having to reach over somebody to get them. So when they did construction, I think they put them back. And but that's where we kept medical records. So we would put it in there, and medical records knew to go in there to get the chart. Same thing. Now with the one floor, the floor that always make the nurses cry, they didn't keep theirs near. They didn't keep theirs near the charts. But that floor was, I already told y'all about that floor. They kept theirs. I want to say theirs was by a printer in the front, and then in the back was just on the counter. Anybody could have got it. I'm just saying. So, but they just weird the way they keep theirs. So that's where they kept theirs. They were the only ones that didn't really keep it by a printer. By the charts. And then our sister floor, now they didn't keep theirs by the chart, by the charts either. Well, technically they did, because it was a big unit and charts were all over. They were like, the unit was in sections. It was a big unit. Okay, it had a lot of nurse stations, to put it like that. And yeah, technically it was by charts. Now I think about it, yeah, it was. So, but it wasn't by the secretary. It was close to us, but we were in like another nursing station. It was like nurse station just went all the way, and it's just charts all over the place. But yeah, it was by charts. And that's usually where you can find a medical record. So if you float to another floor, and this is your first time there, and you break down the chart, and you go, where does this chart go? Like, where do they keep the charts so medical records can come get them? I'm telling you, it's usually look and see where the charts are. And if you don't see any spot with like medical records, like, people that's been discharged, look for where they keep extra charts. Okay? But 9 times out of 10 is where the active charts are. It's somewhere near there. And because I remember the one floor, they kept theirs in the dictation room. And in their dictation room, was just extra charts. So they kept their charts that they were using at the nurse's station, but in the dictation room, that's where they had all the extra charts, because they used to get a lot of patients from other floors, and so they had a lot of extra charts, because the floors, the departments had their own, like they had colors. So like this floor had this color, this floor had this color, this floor had this color. Like if you were sister. So like the ICU and the sister floor had one color, and then the other floor and their sister floor, they had like yellow, something like that. So that's how you knew, because all the floors used to have the same color chart, and it was just they were disgusting. And so one floor bought, actually the main floor I was on bought new charts, and they picked a different color, because the whole hospital had the same color. And our floor picked, because we were like, can we get new charts? And so the director said, yeah, and we got a certain color. So then all the other floors, they copied off us. So that's how the hospital had different colors, each chart. So that one floor, they kept all the charts, like their medical records was in there with the empty charts. And so, but look, I'm telling you, that is the easy way. Secretaries are not hard. Like the only floor was that one floor, but if you watch any of these old videos, you know that floor was a rough floor, and they did everything backwards. Nothing they did made sense. But usually, if you float to another floor and you break down the chart and you're trying to figure out where do they keep the medical records, look for where they keep the charts. It's somewhere near there. All right, y'all, this is J. Marie, and I'll talk to you later. Bye.